Hi, in today's video, I'm going to be talking about this one common habit of snoring, which is generally passed off as something which is very benign and is sometimes very embarrassing or annoying. But how this one common thing can turn into a dangerous and a life-threatening situation if it is ignored. And also, towards the end of this video, I'm going to be talking about a few things that you can start doing from today onwards to get a handle on this condition. The habit of snoring can be embarrassing and can be annoying in many circumstances, but many people think that this is something which is a very common thing that begins to happen once an individual crosses from their 40s into their 50s. In this video, I'm going to be talking about how this habit can become not only dangerous, but it can inform you and indicate significant underlying health conditions and concerns. Also, very importantly, I will inform you about my top 5 things or tips that you can do in order to objectively assess and to take some corrective steps. See, the habit of snoring is more common in men than in women. Perhaps we are unfortunate that we men gather a lot of our weight in the middle part, which is medically called truncal obesity. Truncal obesity creates a significant upward pressure onto the soft tissues of the body, especially when we are lying down. Also, the whole physiology or why snoring happens is that as we gain weight, we actually create a situation where there is this thing called as a soft palate in our mouth, and that soft palate, when we begin to sleep, it flips over and it creates a narrowing of our airways. Besides this, there are certain other situations such as excessive alcohol consumption, especially at night time, creates a situation of excessive snoring. Nasal problems like chronic nasal congestion, and also situations where you are sleep deprived for a prolonged period of time can exaggerate your habit of snoring. And most importantly, it is also the sleep position. If you're lying mostly on your back when you sleep, you are likely to snore more. However, the purpose of this video is not just to talk about snoring, but to understand when this snoring transitions into what is medically called as obstructive sleep apnea. This condition, obstructive sleep apnea, can increase the chance of early death in individuals by 40%. The risks associated with sleep apnea are that of increased risk of stroke, increased risk of heart diseases. And the reason why the stroke is more common in individuals is sleep apnea leads to narrowing of your carotid blood vessels, which is because of the process of atherosclerosis. Besides this, sleep apnea leads to significant mental health issues such as that of anxiety and depression, and more importantly, it promotes the whole issues and the whole metabolic syndrome which leads to obesity because it mucks up your hunger hormones. So the most important thing to ask is, how do I know that I have sleep apnea? Well, there are a few things that you would probably get to hear from other people, but there is also an objective assessment or a test that you can do yourself very simply. So, talking about some of the key symptoms of sleep apnea are, number one, if someone has witnessed that you paused your breathing during your sleep, that is a significant symptom and suggestion that you need to get tested for sleep apnea. Also, daytime sleepiness, when you're so tired that during the daytime you fall asleep. Also, a sensation of choking or gasping during sleep and you have to wake up as if you have not been able to get enough oxygen into your lungs. Also things like restless sleep, and if your partner is saying that you are snoring too much and it's getting worse. But there is this one test, this one app that you can download by this company called Snore Lab. And I'll put the link in the show notes. This Snore Lab is an app that is downloadable free of charge on your mobile device. And what it does is it actually measures the volume or the sound associated with your snoring. It does not fix your snoring, but it gives you an objective assessment without relying on anyone. It gives you a score. If the score is 25 or thereabouts, it is in the normal range. But if it is above 50, it gets significantly serious and you need to get it assessed. So the question then becomes is, what do I do? Well, the first and the foremost thing is that if your Snore Lab score is more than 50, you need to speak to your GP or see a sleep and respiratory physician. You may need to start the CPAP therapy, which is like a mask and it delivers oxygen through that under pressure. But very importantly, small simple things like avoiding taking alcohol at nighttime. Also, treating any nasal congestion, which could be because of allergies in the nasal mucosa, which could be creating those issues. Very importantly, avoiding sleeping on your back. And the most important thing is to manage your weight. See, especially in men, as I just mentioned earlier, we tend to carry a lot of our weight around the middle part. And this weight essentially creates a lot of pressure when we lie down on the bed, and especially when we are lying on our back. In fact, one of the first things that I consistently hear from my patients who've had weight loss surgery, especially when their BMI has gone above 35, is that they have stopped snoring and their partner is happy with them that they're not snoring anymore. So you may want to consider that weight loss or achieving your healthy weight. I have moved away from the concept of ideal weight, but achieving your healthy weight is going to be the key to fixing not only snoring but lots of other medical conditions. So I hope you found this video useful. If you did, do share this with your family and friends, and do subscribe to my channel. That allows me to continue to share this valuable information with everybody. Thank you.